5 important things to know about ANCC's psychiatric mental health nursing exam, how to qualify for it, and how to schedule it. First of all, it's important to know that ANCC is changing their PMHN exam in September of 2024. The old exam will be in place until September 5, and they'll launch the new exam on September 16th. No exams will be administered from September 6th through September 15th. PMHRN is in the process of updating all of our PMHN exam prep materials and will be launching them on August 15th, 2024. One thing we do know is that the format will not change. There are 150 exam questions, 25 of which are being field tested for validity. But of course, you won't know which ones those are. So just assume every question counts towards your score. Up to September 5th, there will be 27 questions on assessment and diagnosis, 27 questions on planning of care, 49 questions on implementation of care, and 22 questions on evaluation of care. Starting on September 16th, there will be 28 questions on assessment and diagnosis, 26 questions on planning of care, 58 questions on implementation of care, and 13 questions on evaluation. You'll be given 3 hours, 180 minutes, to finish the exam. Basically, what that means is you can budget 1 minute per question and still have 30 minutes left over for a short break, a chance to review your answers, and spend a little more time on the questions either you left blank or felt really unsure of. There's no need to worry about those nasty fill-in-the-blank or true-false questions. The format is consistent. A question followed by 4 possible answers. The exam language is clear, the test questions are fair, and there are no tricks. I've taken the exam twice, and both times I came away from it thinking it was actually really well written. So, how do you qualify for this important exam? Well, obviously you have to be an RN with an active U.S. license or have the equivalent license recognized from another country. You have to have worked the equivalent of 2 years full-time as an RN in any field. And you have to have at least 2,000 hours logged as an employed psychiatric nurse within the last 3 years. If you meet those basic qualifications, the only other thing you have to have is 30 contact hours of continuing education in the field of psychiatric mental health nursing over the past 3 years. Does your ACLS renewal training count? No. Does the seminar you were required to take on human trafficking or de-escalation count? Yes. Once you've met all your qualifications, go to nursingworld.org/ANCC to apply. Be sure to ask your nurse manager or CNO if your employer is part of the Success Pays program. Success Pays organizations pay for your registration fee, saving you $395. If your organization is not covering the cost of your fee, you'll have to pay for it out of pocket. But if you're a member of the American Psychiatric Nurses Association, you're given a sizable discount. And ANCC offers big discounts several times a year, so keep an eye out for those. Once your application is submitted, it takes 2 to 4 weeks for you to receive the authorization to test notice from ANCC, which will tell you how to schedule your exam with Prometric. Prometric has testing centers all over the country. Just Google them for locations. You can choose any date that's available within the next 90 days. I strongly recommend picking a date right away and committing to it. Having a firm date is a huge help in staying focused in your exam prep. You're no longer studying for some nebulous date off in the future. And with these resources, you have a date and you have a plan. So, as the Brits would say, keep calm and study on.